Next in radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz, and the date is March 23rd, 2016. Very significant date. We're talking about the 6th anniversary of the passing of Obamacare, and I'm sure the Washington elites are partying like it's 1999, but the rest of us got to pay the bill, the hugely inflated premium bills, and we've got Dr. Elaina George, who better to celebrate this notorious anniversary than with you, Dr. George. Welcome back.
Thank you, Kerry. It's a pleasure to be with you.
So, Obamacare, it's been 6 years since it was passed. It's been a catastrophe from the get-go. We're talking tens of hundreds of billions of dollars and more taxes stolen out of the economy, and less people than ever having health insurance. And the people that do have it have less comprehensive coverage than they had just a few years ago. So how can anybody, politician or not, point to this as being a success?
I think you have to ask what their political persuasion is. Those who love big government think this is a win. If you ask any one of them, they'd be happy to tell you that this is going exactly the way they wanted it to. Their mindset is that the government should control doctors, patients, and every aspect of healthcare. And that's why they blew up the system. I mean, there could be no other reason. And it could never have been that they care about patient health. They want to preserve the doctor-patient relationship. They really want to bring down the costs and improve access. They can't honestly believe that because none of that's gone on. And the only thing that's happened is the government has big-footed itself into the system, and they have regulated doctors out of the business of taking care of their patients. And now they're making patients pay for the privilege of giving up their personal information, their health, to population-based medicine. That's what we're moving towards. It's all about control.
Yeah, well, population-based medicine, interesting thing. So that means that it's no longer you go to a doctor, you get diagnosed, and he or she attempts to come up with a treatment for you. This is just treating everybody the same kind of cookie cutter medicine?
Absolutely. I've been writing about it for years now. I mean, I call it conveyor belt medicine, where you're driven by algorithms, and they make sure that the doctor follows these algorithms set by the government in their evidence-based medicine think tanks. They make sure that you do what you're supposed to. Everything's been put on an electronic medical record system. So they know exactly what prescriptions we write. They all have to be electronic. They know what our diagnoses are for the patient. They make us ask questions about the patient's social proclivities, whether they have a gun in their home. If you're a pediatrician, you have to ask the parent if they think if the child thinks he's a boy or a girl. All sorts of questions that have nothing to do with specialty. It's not specialty driven. It's information driven. And if you don't answer these questions and fill out the correct points in the chart, you can't close the chart. So they make sure that they document, or that the doctor is put in a position where they have to document this information. And it's not in the doctor's office anymore. It's on a cloud. And people need to understand. The HHS secretary gets it. The FBI is going to see it. I think Homeland Security also gets it to view it if they'd like to, the IRS, because people are getting subsidies through Obamacare. So they have to make sure, one, that you're getting the subsidy, that you're getting it correctly, so they see your financials. And I foresaw this ages ago, and I wrote about it. But if you put a diagnosis in of someone being depressed or anxious and they're on medications, how long do you think it's going to take, Kerry, before that goes through, the system? And if you want to get a legal handgun, you may not get one. Or if you have one, you may have it picked up. I mean,
it's happening.
Exactly.
Happening.
People need to understand doctors no longer in this system. Your advocate, they're becoming agents of the government, which is a chilling effect on healthcare.
Well, another amazing thing, Dr. George, is that because of the mandate to go to electronic records, which is very costly for doctors to implement, the large companies such as GE will give you the systems for next to nothing, minor charge, but all your data there, they can do with it whatever they want.
That's correct.
It's in the contract that you, the physician or medical services provider, has to sign with them that they're free to do whatever they want with that. And it sounds like HIPAA be damned.
Well, HIPAA doesn't apply to a lot of the vendors, doesn't apply to the government, it only applies to the physician. So it's an asymmetric application of that law, and it's not right for the patient as well. And, let's go back to the government giving you freebies. Let's say you do get one of these electronic medical record systems. I spoke with a colleague yesterday who said that, he got his reimbursement, I think it was $40,000 or whatever it was the government gave the doctor for applying the health record system. By the time he saw patients, Medicare came back and audited him and asked for, I think, $16,000 or so of it back, and that was going back 4 years. So we can be audited by the government up to 10 years back, and they can claw back money. So there's a whole system within this to make their money back by getting it from the doctors after they've provided the service to the patients.
Yeah.
So this is an extremely disruptive system. Doctors don't talk about it, but this is one of the reasons why doctors are stopping seeing or have stopped seeing Medicare and Medicaid patients, because literally their practices depend on it.
Yeah, I know. Anytime you're taking money from the government for anything, you are going to wind up being their servant. It's really that simple. And here, you've got two masters, effectively. You got the patient, who you're supposed to really, according to the oath that you take, that every doctor takes, put the patient's health first, put their interests first ahead of yours. And then you have the government, which has basically turned that on its head and saying, no, you have to serve the government first and the patient second.
You're absolutely right. And actually, you could say that there are three masters. Those doctors who are employed by hospitals, which is a growing number. I mean, it used to be a minority. Now it's over 50% of doctors who are now employed by hospitals. Their fiduciary responsibility, again, is not to the patient, it's to the hospital and to their case management system, everything that drives them to code and document correctly so that the hospital will be paid. And if you fall outside their parameters, you're considered to be disruptive, and you may lose your job and never practice medicine again. It's something called sham peer review. So there are so many forces now working against the doctor to practice medicine using the Hippocratic Oath, and it's changed the face of medicine. That's why one of the reasons I don't think all of the mantra about repeal and replace means as much as people think it means. The healthcare system has changed. The front line of medicine is no longer doctors on average. It's a physician assistant or a nurse practitioner. The rural hospitals have been depleted because hospital systems have grown and they've either bought them out, bankrupted them, so rural communities don't have the same access to doctors. You have dozens of medical insurance companies now down to 5, soon to be 3. So this consolidation has moved more towards centralization. The most expensive aspects of healthcare are being doubled down on. And that's why the system, I don't believe, it's going to take a long time for it to swing back.
Yeah, no doubt you're correct on that. Maybe we've gone too far. And the candidates, I mean, they give it lip service, the Republicans.
Exactly.
But can you believe a Kasich who opted into Obamacare for Medicaid, or Obamacare as we like to call it? You think he's going to actually repeal this thing? And it may be Ted Cruz, maybe Donald Trump will, should they get in the position to, but then replace it with what? That's really the scary thing.
Exactly. I mean, if you ask an average physician who's an independent doctor, not employed by the hospital, which they never did, if they bothered to ask one of us, we would have been able to tell you it's all about competition, free market, and having us, which we are the cheapest aspects of delivering of healthcare, be on the forefront. It actually costs more money to take a patient to the hospital for a procedure, any kind of test, than it does for them to have it in a doctor's office. It goes up anywhere from 4 to 10 times more because of facility fees and arbitrary costs. There's no transparency. If you ask the same patient, if you tell them that if they saw an independent doctor did direct primary care, if they did that style of medicine, they could be paying $80 a month for comprehensive care with a physician, not an extender, and they could get everything they want. Time, which is one of the most important things, being the attention of the doctor and better health care for a fraction of what they get in a clinic setting. I mean, we could have really helped the situation work and we'd be able to cover people who don't have money. I believe doctors would give charitable care more frequently if they weren't regulated out of business. And they've ruined the system, and it's empowered corporate interests all along the line. And all they care about is the bottom line.
Yep, very true. You're just, like you said, it's all algorithm-driven, actuarial review, and not what's in the best interest for the patient. But luckily, there are options out there, right?
Absolutely. We talk about it. You belong to Liberty HealthShare. I became a member. The medical cost sharing Christian shared ministry option is it's viable. I mean, we talk about it like it's new. It's not. It preceded Obamacare. It preceded health insurance the way it is now. And it's tried and true. It's just gotten to be bigger because people realize, hey, I have a choice. It's a better choice. I'm going down this path. I don't think there's a reason to reinvent the wheel. So that's one option we talk about. Direct primary care practices and cash pay practices that people go to aapsonline.org across the country. They list doctors who take cash-based for their services at discounted rates. You have things like AFLAC, which is a supplemental policy that you can use to cover yourself if you do get into trouble. We bought a policy for our office that covers heart attack, cancer, stroke, and we literally get a payout of $250,000 if we ever get diagnosed with any of these problems, God forbid. Mm-hmm. But we don't have to worry about, can I afford treatment? And for me and my office, adding that to Liberty HealthShare means that we actually get paid if we ever get sick. So I have the happiest, healthiest office in Atlanta right now, and I'm compliant with the Affordable Care Act, and I don't have to worry about what Congress is going to do. I don't care what they do anymore. They're not going to help me. I have to help myself. And again, I wrote a book about this, Kerry, called Big Medicine.
Right, I read it.
I go over all the options and different strategies that people can use, that they can actually take their power back. I don't subscribe to fear, and I think that's one of the major things that drives us apart. Fear of someone taking something from you, fear of not being made whole. I don't know, whatever the fear is, it makes you being driven by emotion. And as soon as it happens, you lose all reason if someone leads you around by the nose. These are valid, viable, cost-effective options that fit whatever your pocketbook is and whatever your political persuasion is. Who cares if you're Democrat or Republican? You still need health care, and you still need to be able to afford it. And that is an option that people should take a look at, frankly.
Yeah, absolutely. Can't say enough good things about Liberty HealthShare. I mean, not only are they a sponsor of the show, but I'm a subscriber to them and only had positive experiences. You basically pick your own doctor that you want to see, and you go see that person and you explain to them you got this Liberty HealthShare. They call up, they make a deal with Liberty. They make a deal with your doctor, right? And
yes.
It's that simple, right?
You don't do anything. You just give them your card, and the doctor's office will contact Liberty HealthShare directly, and bam, it's done. I don't care if it's a doctor, hospital, radiology center, whatever a medically necessary service is, covers it. Yeah. And even if it's holistic, it covers it. And they're really looking outside the box. They're talking about doing medical tourism. So it's very much member-driven, unlike a commercial insurance. If I said I wanted something covered that was a little outside the box, I could basically, if I ever got anybody on the phone, that would be interesting in itself. But they'd give me a big fat no. I don't want someone to tell me what I can't do. I want someone to work with me to figure out what I can do. And that's a different mindset. And it's awesome. And it does exist. It seems like, it's too good to be true, but it's not.
Yeah, definitely not. Definitely. And yeah, it's hard for you, the individual, to kind of wrap your arms around it. It's so much different than everything you've encountered up to now. Dr. George,
I know.
It's people just say, wow, and I'm saving so much, it can't be real.
Well, I think we've been victims of a concerted campaign to make us think, as doctors and patients, if you don't have insurance, you're going to die. That's the mindset. That's what's been drummed into us over the past 6 years. And I have to tell you, it sounds a little hyperbole, but honestly, it's really set in truth. If you do have health insurance, you're going to have to fight to stay alive, because they're actually in a mindset now where they want to deny you care. Their insurance companies are practicing medicine. And if you get diagnosed with a high-ticket problem, they're talking hospice. And I'm talking 40-year-olds so going to the hospice, not 80-year-olds anymore. They want to cut the costs. They want to make sure that you pay a premium, and they pay out as little as they possibly can.
Yep, they're in the business of not paying claims. That's what my father used to say. And it's gotten even worse. They got to pay out a little bit to make it look legit, but Hey, it's all about denying them. And supposedly under Obamacare, they're supposed to pay out 85% of all the premiums they receive for healthcare, except that this is based on projections. I don't believe it's based on the actual expenditures of the company. And therefore, it's in their interest, because they're getting 15% of the whole, to be as inefficient as possible. So they increase the expenses and thereby increase the premiums, because as long as the pie keeps getting bigger of premium dollars they're receiving, they're going to be making more money. And I think it's just like utilities, public utilities, the same exact inefficient model here, Dr. George, and really hurting the public. And it's just good to know that you can do things, that you don't have to be part of the herd.
No. That's the beauty. You can find your own path. It already exists. You have to decide to make a change and walk down it. That's the great part. You don't have to reinvent something or invent something new. Just open your mind and investigate it. Call them. What do you have to lose? Make a call and see what's out there. It's pretty incredible. You have MediBid, which is a company that has bids. You can bid against other doctors for services, so you can get that as a discounted rate. There's bartering, something called Southern Barter Club, which is in the Southeast, but there's another version in the West, where if you have a service, if you own your own business, you can barter the value of your service to get anything you need, whether that's health services, painting your home, getting vacations, etc. We actually barter in our office. So we have lots of ways for our patients to see us that don't break their bank. And that's the key. It's all about being innovative and working with the patient. I have the incentive to do that, because I run a small business, but I wouldn't if I was employed by a hospital. I would be 9 to 5, and 5:01, I'm out of there next. That's the mentality. Do you want a doctor who thinks that way, or do you want one that knows you, your family, and will work with you? That's the difference.
Yep. So if you're interested, go over to joinlhs.com. You can sign up today, go through a screening process, minor screening process, but just to make sure that it's the right fit, because you've got to have a healthy lifestyle and you've got to be in fairly good health. And I highly recommend it. I mean, I can't even tell you how much I've saved over the past year. It's phenomenal. And they've been there for me when I need them. I got to get a procedure done shortly. They're going to take care of that. It's just an incredible experience to be part of. Dr. George, where do we get your book?
You can get it on my website, drelainageorge.com. That's Dr. George, like the man's name.com. You can buy it also on Amazon.com. And hopefully you'll get it, and you'll only what you can do to help yourself. But how we got here, it's a long process of how we came to be at this point. And I don't believe it was by accident.
I totally agree with you on that. And as always, you will find a link to Dr. George's site on our site, financialsurvivalnetwork.com. Take a look at it, sign up. We've got an event coming in Florida on April 21st with the guys from Miles Franklin. It's free. You don't want to miss it. And Dr. George, keep up the fight. And happy Obamacare anniversary.
Thank you, Kerry. It's a pleasure being with you.
As always, thanks.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.